Hi, my name is Peter.
And my name is Tracy. We are registered nurses working for Southern Cross Care Community Health and Wellness.
Today we are going to discuss medication management and skin integrity.
We will be giving a broad overview of these topics. However, if you have any concerns, you will need to refer them back to your GP.
Today we are going to be talking about medication management in the community. What does this mean for you? Are you currently taking any medications? Do you know what you are taking them for? Sadly, did you know that 72,500 Australians living in rural and remote areas are admitted to hospital each year due to medication-related problems? 50% of this is preventable.
As we age, our body changes. We become more sensitive to the effects of medications, the way medications are absorbed. We have difficulty removing medications from our body. We become more prone to side effects and medication interactions.
Our brain and nerves also change with age, so problems like memory loss or poor eyesight might start to affect the practical aspects of taking medicines. For example, it is easier to accidentally take your medicine twice or forget to take it at all.
Okay, Peter, what can we do about it?
Well, when you are next at your GP, ask some questions like, why do I need to take this medicine? What should I do if I notice any side effects or symptoms? Some of the common side effects are diarrhea, dizziness, drowsiness, fatigue, heart issues, hives, nausea, vomiting, and a rash.
Okay, thank you. What are some of the other questions I can ask?
You can ask, what should I do if I don't feel like my medication is working? Are there any precautions I need to take, such as not driving? Could this medication react with medication I already take? Do I need to have regular tests, like blood, kidney, or liver, to check how the medicine is affecting me?
Okay, great. Is there anything else that I should do?
Yes, you can keep a medication list. This medication list can be used to keep track of what each medication is for, the dose of each medicine, time to be taken, and how to take it.
What else can I do?
You can ask for a home medicines review.
A what?
A home medicines review. This is different from a medication review by your GP and hospital. A home medicines review makes sure that you are taking medications correctly.
How can I organise this?
You will need to get a referral from your GP to a pharmacist. The pharmacist will come to your home and talk to you about your medications you are taking. They look at all prescription, non-prescription, and complementary medicines like vitamins and other supplements. They check that you are taking them correctly, how to store them, suggest ways to remember taking them at the right time, and suggest if medications could be changed.
Can they show me how to use medical devices like inhalers and blood pressure monitors?
Yes, they can, and they can show you how to use blood glucose monitors. Most importantly, a home medicines review involves you and helps you understand what each medication is treating and to ensure that each medication is exactly the right medication for you. Once complete, the pharmacist will send a report to your GP.
Did you know it's also important to let your GP know if your medications are not having the desired effect? It's also important to let them know if your medical or physical function has changed. This may include falls, forgetfulness, dizziness, weakness, nausea, changes in your swallowing, and the list goes on. Sometimes this can indicate a medication interaction.
Did you know that 1.2 million Australians have experienced an adverse medication event in the last 6 months?
Taking multiple medicines can also mean a greater chance of making mistakes. Because you have more medicines to manage that often need to be taken at different times of the day or even week.
That's fine, Tracy, but what can I do about it?
Talk to your GP or pharmacist about a dose administration aid. This can be a dosette or a Webster pack. Sally, our OT, briefly mentioned these previously. It is a perfect solution for people who take multiple medications to ensure they take the right dose at the right time. All your medications are put in the Webster pack, a sealed weekly calendar that helps you remember. This is what it looks like. Your medications will be listed along the side with a brief description of what the tablets look like, days of the week along here, and the times that the medications are to be taken.
Our medication management take-home messages are: we understand that medication management is complex and we have only briefly touched on this area. However, this is your responsibility. Know your medications, ask questions, don't ignore symptoms, and have a regular review.
As we mentioned earlier with medication management, our bodies change in many ways as we age. Remember when you were 5 years old and fell over and scraped your knee? This would heal after a few days. However, as we age, our skin loses its ability to regenerate itself. This is why it may take an older person weeks or months to recover completely from a minor injury. We will now touch on skin integrity.
Over the years, our skin becomes thinner, more fragile, like tissue paper. The protective layer of fat that lies just below it begins to disappear. Skin bruises and can tear more easily. Some medications, commonly used by older people, like steroids such as prednisolone and blood thinning medications such as warfarin, Plavix and Eliquis, can contribute to this. Simply bumping up against something may cause a bruise. In addition, chronic medical conditions common to older people such as diabetes and circulation problems also result in fragile skin.
Be kind to your skin. Your skin is the body's largest organ. It is vital to good health as the skin acts as a barrier to microbes and toxins. If you treat it with care, it can better protect your body from the elements, regulate your body temperature and provide sensation. To keep it looking and functioning at its best, wear sunscreen and protective clothing when outside. Get yearly skin cancer screenings. Stick to gentle products in your anti-aging skincare regime. Stay hydrated and eat a well-balanced diet. Bonnie, our dietitian, will provide you with some further information with regard to diet during her session.
Our take-home messages are: good nutrition and hydration, changing positions regularly and staying active will support good skin integrity. Remember to talk to your GP if you have any concerns or notice any changes with your skin. It's never too late. We can help reverse the sun's damage.